Hi, Dr. Yass here. In this video, I thought that I would try to represent the types of medical establishment responses that you could expect relating to your pain versus the Yass method. And I wanted to try to do it in a non-medical format. I definitely think that as you start to talk about things that are medical and use medical terms, I think people become intimidated. And I think that leads them to almost shut down in their attempt to learn about how to address their pain. What's the proper mechanism? And so I thought if I gave this example, this is an exact metaphor for what you get when you go to the different types of medical specialists to address your pain. And so in this video, I'm using a wet wall, which can be seen right here, to symbolize having pain. These are the symptoms. Your symptom is pain. Here we're representing pain by an obvious wet wall. So you're in your house, you have this wet wall. What would we expect an orthopedist or neurologist to do that would help you to resolve this wet wall situation? Well, you have to assume the first thing they're going to want to do is take a picture. In the body, when you have pain, they take pictures by getting an X-ray or MRI, and it finds a structural variation. Here, they're going to take a picture and they're going to say, look at this picture. Clearly, the sheetrock is wet. A blind man can see that the sheetrock is wet. The picture shows that the sheetrock is wet. The X-ray or MRI shows that you have arthritis, shows that you have a pinched nerve, shows that you have a meniscal tear. What we're going to do is we're going to have to replace this sheetrock, because clearly the sheetrock is where we see the problem here. We found the problem in the sheetrock. The sheetrock is wet. You have arthritis. You have a meniscal tear. You have a pinched nerve. You have stenosis. We found it. We need to fix it. So you'll be recommended to get surgeries, and they'll try alternatives before it. But ultimately, if alternatives don't work, you're going to get a surgery because a picture was taken that showed some structure that supposedly represents the cause of your pain, and it is simply identified as the cause because it showed up in the X-ray or MRI, just as the wet sheetrock in this picture would make them say, you need the sheetrock replaced. Does that make sense to people? Hopefully that makes sense to people. So you might get that surgery, or maybe they'll try something conservative and say, before we replace the sheetrock, let's try something else. We clearly have wet sheetrock. So you're going to go to a physical therapist. And the physical therapist is going to do things because there's the wet sheetrock. I'm going to try to adjust the sheetrock, which is, again, the equivalent of what? Pain. So when you go to physical therapy, they try to address the symptom, right? That's what they do. They address your pain by doing certain types of activities, right? So here, they're going to pat the wall down and see if they can dry the sheetrock out. Or maybe they'll use a blow dryer to try to make the sheetrock dry. Or maybe they'll use ultrasound, cold laser, dry needling, things that have no value whatsoever. But what the hell? You're with us. It's a fee-for-service basis. We get paid to do it. So I'm going to use that to try to dry the wall. And most likely, because the sheetrock is probably getting wet from another reason, the sheetrock, every time they dry it, it gets wet again. And that confounds the physical therapist. I do ultrasound, electric stimulation. I tell you, do some stretches, blah, blah, blah. You're still in pain. Oh, well, your insurance ran out. End of physical therapy. Right? So again, let's understand. The physical therapist addresses the symptom, supposedly, of pain by using these different techniques, just as the wet wall representing the pain. They're going to pat down the wall, blow dry the wall, do whatever to try to address the fact that the wall is wet, but somehow the wall keeps coming back wet. Then you'll try a chiropractor, and the chiropractor is very clear, very distinct. I'm going to adjust the sheetrock. I'm going to manipulate the sheetrock because that's going to make everything better. The theoretical basis of chiropractic. The adjustment fixes everything, right? You have pain, just get an adjustment. That's the answer, right? The chiropractor talks about you have subluxations. Unfortunately, the definition of a subluxation is that the surfaces of a joint become misaligned and then realign themselves. That is the difference between subluxation and dislocation. So even the terminology subluxation doesn't even make sense. If it was subluxed, it went out of alignment and realigned itself. So then what do you need treatment for? Very confusing. But the answer is, for a large portion of the population, just adjust the sheetrock and it's going to make it not be wet anymore. Then, of course, there's the most psychotic of all, which is pain management. And what pain management's going to do is they're going to either give you an epidural or maybe give you some opioid, synthetic heroin, and their goal is to simply to get you so disoriented that you just forget that the wall is wet. That's their goal. Even forget the wetness. Don't even think about the. We're going to do everything in our power to make you not even know wetness exists. And that way, at least you won't think about it or experiencing it. And that way, it won't feel so bad. It won't be such a bad situation. And that's pain management, right? Their attitude, once you have pain management, you basically see the medical establishment raising the white flag saying, we're giving up on trying to identify the tissue in distress eliciting your symptom. We're just going to try to mask your brain's awareness of the symptom and hope you can live the rest of your life like that. Clearly, that's what pain management is. When you start pain management, you end diagnostics. You better understand that principle. So there's your orthopedist, your neurologist, your physical therapist, your chiropractor, pain management. And you can see that regardless of any of these types of understandings, you're never quite getting to at the core of, why is that sheetrock wet? Because none of those specialties attempts to understand your symptoms. You have pain, there's a reason. The symptoms are being elicited by a cause. Therefore, the best way to interpret what cause is creating the symptoms is to interpret the symptoms. That's what's at the basis of the Yass method. So the Yass method would say, wait a minute, sheetrock doesn't emit water. Something is acting on the sheetrock. Addressing the sheetrock probably isn't going to stop it from being wet. Oh my God, I think there's a pipe behind the sheetrock that's cracked and broken. I'm going to fix the broken pipe. And lo and behold, by understanding the concept that sheetrock doesn't emit pain, wet water, that in fact, water must be coming from something other than the sheetrock, and it is acting on the sheetrock. That would represent the symptoms being that the cracked pipe is causing the wet sheetrock. And therefore, to stop the symptom of a wet sheetrock, we need to fix the pipe. That's how the Yass method works. When you're having symptoms, the symptoms represent what the tissue is in distress. If your symptoms aren't continuous and at a roughly similar intensity all the time, how could you tell me that the cause of the pain is structural, that the MRI finding is valid in identifying the pain? Clearly, that arthritis is always there. So why is it that your pain is intermittent, that it doesn't have a consistent intensity? Are you saying that there's variation in the arthritis? It grows and shrinks based on the day or the time of day? Does anyone think that makes sense? Clearly, that can't be true. So the symptom tells you, that singular symptom tells you it can't be structural. The fact that your pain comes on based on the activities you do, and then when you rest seems to diminish, seems to lead to the idea that the tissue responsible for the symptom is muscle. Well, the wetness of the sheetrock seems to increase every time I go to brush my teeth and I turn the water on. Wow, the symptom represents the cause. I constantly am trying to find ways to help people understand what tissue is creating the symptom. And I've shown in more than 98% of cases it's muscle, and muscular causes don't show up on diagnostic tests. And there is nobody, no medical specialty educated or trained to identify them, which is why chronic pain exists, misdiagnosis. And I, in thinking about it, thought this wet sheetrock is so apropos. Just because you see sheetrock is wet doesn't mean the cause of the problem is that the sheetrock is wet. It just might be that the sheetrock wet is a symptom of something else causing the sheetrock to be wet. So you have to interpret the symptom. Just because you can take a picture of wet sheetrock doesn't mean that's the cause of the problem. Just because you can take an X-ray or MRI of a herniated disc, stenosis, arthritis, a pinched nerve, doesn't mean it's the cause. Look at the symptoms. If your pain is not continuous and varies dramatically based on activity, and in fact, it's activity that initiates your symptoms and rest seems to make it better, you've got a muscular cause, end of story. I don't care what picture they show you. I don't care how many times they take a picture of the wet sheetrock. Replacing the sheetrock isn't going to fix your problem. You got to fix the pipe behind. Sheetrock doesn't emit water. Herniated disc, stenosis, arthritis, pinched nerves doesn't create intermittent pain that seems to be associated and enhanced when you do activity. I hope this educates people. If you like this and it makes sense, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get notifications so you get notifications when new videos like this are added or when I'm live on YouTube. If this is starting to percolate in your brain and it's starting to make sense and you want to contact me at my email address, drmitch@mitchellyass.com, or you could go to my website, livewithoutpains.com, and you can contact me. There's a contact us email that you can send. Either way, you can contact me. If this is making sense and you're like, wow, you know what? I think this is probably related. I probably have a muscular cause, and you want to get a Yass Method Zoom session, because unless you're in Jacksonville, Florida, you're probably going to have to get the method virtually. You could go on the website, livewithoutpains.com/sessions, and schedule a session for the day and time that's most convenient for you. I love having the opportunity to explore my brain and come up with ways to explain the medical system in a way that the average person can understand, because no one should expect you to have to dive in and understand technical information, medical information. I think that what's wrong with the medical system has nothing to do with medical. This is 100% the logical presentation. This is understanding the theory behind symptoms and causes. You don't have to be medical to understand that. You just have to understand logic, and logic says that each particular tissue creates a specific symptom, and each specific symptom is representative of a specific cause. And if you accept that and then start to understand the symptoms, then you'll see why in more than 98% of cases, the cause of pain has been shown to be muscular. So with that, I wish you a pain-free and fully functional life. Bye-bye for now.